Hi.
Hello.
Kristin. Nice to meet you.
Is it Ran? Is that how you say
Ran.
it? Ran.
Oh, yeah.
Nice to meet you.
Nice to meet you too.
Shooting it raw?
Yes. Shooting it raw. There have been, I think, 2 photos of elephants. And so what country is this made
That's in Thailand.
in Thailand as well.
Elephant Nature Park, yeah.
Yeah. So the photograph is, it looks almost like there's a bamboo or something in the way because there's something shadowed.
I think it's just a shadow, though. I am officially kissing the elephant's trunk.
Yes. So
again, thinking you just can kiss animals because why not?
And the elephant is responding.
Yes.
So the majority of the image is just you in your baseball caps, sunglasses, leaning in to give the trunk of this incredible animal a nice little bit of affection that they who knows if they consciously or definitely appreciate it, but I'm sure on some level
I think
they must appreciate
I think so. I think animals are more in tune, especially elephants, for the reading and the learning that I've done. I think they're more in tune than we realize. At least they certainly have memories.
For sure. For sure. Okay. Memories. When you came to Hong Kong, did you specifically come to transport, relocate, import your work, knowing that that there would be a market for what you do? Or was it more like, well, I think it will work, and I'm going to come and make it happen?
The main reason I did come was my husband's job. But before I decided, okay, we could do this, I did come and speak to some therapists about how you can work here. Do you need to get licensed? And is there a need? And I did get some feedback that there were not many people, or hardly any, that do sex therapy. So I knew it was a good niche to continue on working in. And I also felt like, since I could actually be a psychologist here, I can work and bring sex therapy here. I thought, how fantastic, because in America, there are quite a few sex therapists and you can get that support, but I like the idea of coming somewhere where people really need it and they don't have a lot of information. And so I felt like I was kind of filling that need, also being able to continue my work, because that's really valuable to me. Being a psychologist and sex therapist, it's like, it's part of just who you are. You know, it's not one of those jobs, I'll look at a list and I'll check that off and do that. No, it's more about like, it's a passion. It's about, you live the work, you breathe the work. So I had to make sure I could continue with that. So when I realized I could do the work here, I said, okay, let's try this new journey.
Wow. So describe how your training, your development. So the different pillars I had mentioned in the podcast, one of them is service leadership, right? So that's like looking at people's maturity and evolution as service leaders. We talk about physicians, doctors, there's the competency of doing what they have to do, but there's also the service side of who you are. And that's the interrelation, connection, energy you create with the other person. Starting from when you were young, how did what did that road look like that landed you as a sex therapist in Hong Kong?
Well, I first became a psychologist. I went to undergrad and I majored in psychology and sociology. I've always just been interested in people. Like, why do we do what we do? Why does a brain think the way it does? I've been always wanting to ask the questions and get to know people and connect with people. There was just something there.
Sure.
So I went into that field and decided, I could continue doing this work. I didn't see myself going anywhere else, but somewhere within this field of understanding, learning, listening, and caring about people. So I went on after my undergrad finished, I went straight into graduate school for my doctorate in clinical psychology.
Oh, wow. Okay.
So I just kind of kept on going. I'm like, you know what? I'm on this path. I don't know how hard it's going to be to get back here, so I'll just keep on going.
Oh, wow.
So I just continued that for another 4 years.
But this was a doctorate in clinical psychology research-based? Like...
You do your own research.
So what was your area?
Had to do with acculturation and gender roles.
Okay.
So it was interesting. Even back then, I wasn't a sex therapist until, when did I become a sex therapist? Like 2013, right? No, yeah, it's 2013. I'm like, that was the date. Gosh, it's been a while. So it was a while before I actually decided to go that path, but I knew that there was gender, sexuality, and also my graduate program had a multicultural focus. Mm-hmm. So we incorporated that because there wasn't a lot of multicultural research going on back in the day in psychology.
Right, and this is in California?
Yeah.
Okay.
Yeah.
Okay, wow.
So that's why I kind of put it all together and kept on going with that doctorate. And at first I worked with all ages, children, groups, adults, geriatric. I did psychological testing, crisis, you name it. You just kind of do it all to kind of see what ticks.
Sure.
And that way you can also know how to work with all sorts of folks. And then after working at a major hospital and a group practice, I narrowed my work down to just a private practice. I knew I wanted to be able to kind of have my own control and work for myself. So I did a private practice for about 15 years.
Oh, wow.
In San Diego. So that was what I was running before I came to Hong Kong.
Wow. Okay. Wow.
Yeah. And so it was interesting. You're doing your work, you're feeling engaged and interested, but then I always like to learn a little bit more, grow a little bit more. And the idea of sex therapy came up because I had a fantastic teacher in my graduate program, this professor, Bryna. And she was this funky woman who just talked about sex and with so much humor and so much ease and made you feel like anybody could talk about sex. And I already liked talking about sex. It wasn't a big deal for me to discuss those issues, but she just made it so accessible.
Yeah.
And I thought, you know what, bring that to people because there's so much shame, so much embarrassment and discomfort around talking about it or about its own sexuality. So I just thought about her. I'm like, I want to embody that. That's when I looked into, becoming a certified sex therapist, which the organization you mentioned at the beginning, ASECT, that's the largest governing body of sex therapists. So I went through their really rigorous program for about 2.5 years. Wow. So you learn about the biology, the psychology, the cultural parts. You learn about so much. And then started working with folks. Wow. And it's been super valuable. That part where when people come into your office and go, I had no idea where to go with this. I've had no one to talk to about this issue. And now I have somebody who can not only understand, but be compassionate, make me realize I'm normal, I'm okay, I'm not alone.
Yeah, I'm
That's
nodding.
The part.
For the people who are listening, I'm nodding like, yeah.
Yeah, I mean, that's the most rewarding part because, again, people live with so many feelings around their sexuality and just keep them inside. Sure. And too scared to talk about it.
So, in my previous life, not too long ago, I have some medical exposure to Hong Kong's medical community. And early on, I was asked to do an interview of one of the heads of Hong Kong's psychology, the department with the hospital authority. Okay. And we were talking about how many resources there are in Hong Kong around mental health and how for the population, it's really low. Now, have you, in coming here as part of your own, whatever you want to call it, due diligence, said, well, how many people are there who do this? And then you realize there really aren't that many.
Well, it's interesting. I've always heard there's not too many really great therapists in Hong Kong because I guess for the population, But thing is, I work with let me see. Maybe I'd say 75% expats.
Yeah, okay.
I'd say that's about it, and 25% locals.
Right.
So I guess it depends what group you're talking about and who you're trying to serve. I do believe more lower fee therapists, there's not a lot.
Okay.
So it's unfortunate. The therapists that I know 100. I'm on a group chat with 100 therapists. Right. Now, they work with all sorts of people, from children in schools to just couples to adults. But and then plenty of them do work with locals. There are services, it's just for a lot of these services, there is a pretty solid higher fee. That's the issue, I think. It's not as accessible as it needs to be.
Have you made any observations, even though it's within the expat community, and you have a background in sociology, anthropology, you can make educated guesses of patterns and cultures. So what's the patient profile here? How different is it from here compared to... California is famously way more open, right? in terms of what you see in your practice, like here in Hong Kong, how would you describe the difference between, is there a difference?
Oh, yeah. Okay, well, there's a difference in similarities between with the sexuality part or just in anything.
But however you interpret that question.
Yeah, because that's interesting. Since I do work with sexuality a lot, there's a huge difference.
Oh, okay.
I mean, people would come in San Diego, and I'd see some multicultural. I mean, some different cultures, but not as many as here, obviously. They'd come in with, I think, a lot more knowledge around sexuality, their own sexuality, and maybe fine-tuning things,
right.
or again, having some more specific sexual dysfunctions they wanted help with. I'm finding here with some folks coming in with a real lack of some more basic knowledge.
Right.
And again, sex ed around the world is taught very differently, right? I mean, you have people in, like, say, the Netherlands who have a very broad, open education on sexuality, which is fantastic.
Yeah.
But then you have other cultures, some more Asian cultures that are definitely have less information. So they're coming in with a lot of kind of expectations that are unrealistic.
Okay.
And, you know, a lot of things like from the movies, you know, like this is how I should be. This is how sex should be. This is how my body should perform. And I have to do a lot of education. Like, that's not real. So there's that piece. But here, culturally too, like I can see, say, 5 clients in a row. I do couples and individual work for adults. I can have 5 different clients in a row from 5 different cultures.
Right.
With 5 different accents.
Right.
And then with also like interracial relationships. So it's so dynamic and so diverse. So it's definitely keeping me on my toes. And I'm certainly learning a lot. So you'll have that layer more. Just a lot of, you have to kind of look at, okay, from your religious background and your cultural background. And then in the couple, all these 3 mixed together. How do you hold all that? So there's just a lot more layers of that.
Sure. Okay. This is going to be a question that's going to, well, it'll be what it'll be. When you have somebody come in who is reluctant, because it's in terms of couples, right?
Yes.
So one person will be like, this is a good idea. The other person's like, I don't want to. And the reluctance in terms of sitting across from somebody, and it's like, I don't want to air out my laundry and have somebody sit there and judge me. So if somebody is listening to that, in that situation, what advice would you give them?
Well, I'll tell you, can I just back up on that question? Because there's different reasons people don't want to come in. So it's about finding out, well, what is this about? Because there are some people who don't want to come in because, look, I don't really want to work on my relationship. I'm pretty much done, which is one set. But there are people who come in, and they often will feel like, and I'd say, if I can say, it's usually more men, usually.
More resistant?
More resistant. Not always, but usually because they're not used to expressing their feelings, talking to this woman about their feelings, and especially if it's sex, it's very private. So, I mean, I definitely can relate and understand that. I know I'm the stranger you're talking to, and we don't have to get right into it. I work on kind of building rapport.
Sure.
So I definitely work on making it comfortable for people. Hey, I know when I first went to therapy and how scary that can be, and you have to trust this person, and you don't know how they're going to react to what you have to say. So my main goal is just to let them know they're safe. It's a confident, comfortable place. It's, it doesn't leave this room, what you share. Right. It's all between us. And just kind of help them, like, be where they are. And as they feel more comfortable, they'll open up and they'll see that there's something you can get out of this. Right.
So one bit of a paradigm shift that I had was, I kind of understand. Okay, quick question. What is the youngest age client that you've had?
Well, I only work with adults now, but back in the day when I did work with children, I'd say probably about 6.
Wow. Wow. Okay.
Well, because if, say, parents are divorcing and a child's having feelings, then, you want to be able to support them, just give them a place to get out, whatever.
Okay. So what the paradigm shift I got was this idea that a lot of mental health access or treatment is through discourse, right? So it's like you have to speak and express yourself in order to get to wherever it is you need to get to have that change. Okay. And then I met this one art therapist who the school of thought is completely, it's more like, I don't care about your story. In fact, you're going to do a process that itself is the therapy. So the process of, for example, working the clay, the process of using paint, the process of using the color, it's separated from discourse, right? So how do you recognize when somebody comes in and says and offers some kind of issue that is outside the bounds of counseling, but it was within a couple? Right? So do you just say, oh, well, in this case, maybe you need to see a psychiatrist, or like in this case, it's more like it's more physiological as opposed to a mental block?
Well, if it is more physiological, especially within the sex therapy world, we rule that out. If someone comes in with some kind of erectile dysfunction, or a woman comes in with some genital pain, I'll always say, hey, we need to have you go to your doctor first, make sure you rule out if there's any issue there. And if they say, no, there's nothing that we could find, then we would look at the psychological component. So I do work with other doctors or pelvic floor physical therapists, psychiatrists for medications. Yes, I do talk therapy. Some of my interventions are more body-based, meaning doing some breathing exercises, touching exercises. So there is that component. But if I feel like they might benefit from a different treatment modality,
sure.
Like you mentioned, art therapy. Some people are more into that. There's also more trauma-related therapies that do different kinds of things that aren't about talk.
Right.
So there's enough little specialties you can kind of send somebody to someone you trust that is in that if you need to.
Right.
Yeah. I hope so.
How do you feel?
I'm good.
Awesome, great.
Like I said, it's like I'm used to asking the questions. So this is nice. This
no, but
is a
it's
nice difference.
So with a title like Shooting It Raw, don't spit out your water. So the title of Shooting It Raw, my gay friends are just like, that sounds like a really good podcast. I'm like, slow down. Slow down. So I want to get I want the fifth theme pillar to be sex and sexuality and mental health, like for sure.
I gotcha.
And so what can you say to like, let's get outside of Hong Kong.
Yeah.
Let's just like pull back and say, just overall as a human animal, like the species, but like, what has your experience shown you about, because I find it shocking that words like shame are part of, I kind of feel like at this day and age, really?
Yeah.
But clearly.
Yeah.
So what is wisdom can you give about that whole part of helping people?
One thing, if I'm hearing you ask this question, and the way I interpret it, like one of the gifts I try to give, if you can call it a gift, is that help people realize that there's such a huge variation of normal. And the thing is, when people's bodies don't act a certain way, the way they want it to, and maybe I should explain that because I know what I mean, but like, oh, I am not getting the erection I think I should get, or I'm not getting aroused, the way I think I should, or I'm not doing a sexual act that my partner wants, or I'm not turned on 24/7 like I think I'm supposed to be. Like, there's so many versions of what's normal. And so people come in thinking like, I'm not good enough. I'm not going to be wanted. I'm not going to be loved the way I am. There's a lot of that. I mean, there's so much more I could talk about around shame and sexuality from history. But that, when people come at that, I just try to help them see, look, who you are is who you are. Let's love you for who, you love yourself for who you are. Be the best version of who you are. Have compassion towards your own experiences in your body and towards your partner, and have empathy. And I think the best of you will come out.
Okay.
So I think that's a piece. I mean, obviously, again, if there's like some kind of physical or something that needs to be kind of taken care of physically, okay, we can do that. But otherwise, I just feel like such an important piece. If people come in, shame gets passed down to people too from like families. Like say parents, got shamed for doing certain things. I don't know how explicit.
Be as explicit as you like.
Okay, because I'm trying to like be polite.
It's shooting it raw. Like,
okay, okay, but that's right. From like kids getting caught masturbating, for example, and they get told, "Don't you do that? That's bad." It's like you might think that's just one message, like one conversation, but they might internalize that like, "Oh, touching my genitals is bad," or "Sex is bad," or I'll have people. Oh gosh, I see this quite a bit where maybe in their religious background it says, okay, sex is for when you're married, so you can't have it before you're married, and if you think about it or try to do anything sexual, it's bad and shameful. Right. But then they come in to see me because they're married, and they expect all of a sudden, like a light switch, they're gonna have great sex.
Right,
and they don't
right.
understand why. It's like, well, because you've had years and years
Sure.
of being told it's a bad thing, so how do you just switch your brain? So there's a lot of that I have to kind of work on working
Right.
with people. And again, sometimes, parents might shame their kids not meaning to, but that comes into play. Or people just have, like, experiences, like sexual experiences where maybe a partner, was unhappy with them and shames them.
Laughed.
And they laugh.
Yeah,
Oh, I've had
yeah,
that.
yeah,
Or like,
sure.
oh, look at you. And
Yeah.
oh no, that's like traumatized them for life.
Sure.
So there's things like that.
Such a nice way of, that traumatized them for life. It's fine.
I'm so used to talking about it that I
It's
think I
great.
just say it like that.
No, it's great. It's great.
Yeah, so...
No, I love it. So I've been here 17 years. My perception of the Hong Kong experience is very dense, right? Super densely populated, lots of action, lots of intensity, but the cost that I've felt personally, so I've had 3 near-death experiences, totally fine. No, nothing.
Wow.
But then, living in Hong Kong during the financial crisis, totally brought up general anxiety disorder, so I had to actually medicate for it, for the panic attacks. I think to myself, life in Hong Kong, which is so full on, is kind of what triggered all these things. So in terms of mental health and sexuality, where you need intimacy, you need that quiet space, in a society where you're so, like, there is no real quiet, or there's no quiet space, but there is no, like, Hong Kong is famous for like in those sex surveys that they have as one of the lowest scores in terms of sexual frequency. I don't know if that's just because that was in funded by Trojan, I think, a few years ago, of course.
So you gotta look at
I don't know how scientific it was as it was just a qualitative survey, but I kind of feel with everybody living on top of each other, next to each other, with no space.
I'll tell you. With this
Please do.
I talk about this one. I'm going to talk about the anxiety in a second, but the pandemic. With people stuck on this island, a lot of people not going into the office, in each other's space, and already small spaces, I've seen a lot of sexual challenges, a lot of lack of desire. People seeing their partners like, yes, and you're on the couch, and you're in your casual clothes, and then you're working in the office, which is literally on our kitchen table, and we have no separateness. I've seen a lot of challenges in couples because there's no sense of longing, of missing. There's people who's like, yeah, my husband would go traveling. He doesn't travel anymore. Or at least go to the office, and we'd have some missing youths during the day.
Right.
There was none of that.
Right.
So a lot of people then are with each other 24/7, and then the challenges that they have that maybe they could travel and forget for a bit, come to the surface even more. And it's this manufactured, like, time together that's just too much. We can't be with each other that much and think we're going to be happy for most people. So that's created a lot of challenges. I also think, the anxiety piece, this is a go city too. It's like go on, busyness, hecticness on each other. With that anxiety, that is a big presents as a big challenge for sex for a lot of people. It's the anxiety and worries that when you're in your head and you're worrying, you're disconnected from your body.
Sure.
So a lot of times I'll work with people to try to get out of their head and more into feeling their body. So
like butt plugs, I guess.
That's one thing you can use.
I'm just projecting. Sorry.
I love it. No, you're going to answer it. Yeah. That way,
it's just a way of getting a person out of their head.
That is.
So is life really a gift? Really? Can you make every second count? That's the whole point of the podcast. So if you like what you've seen and you're inspired, because that really is my mission, then please give it a like, subscribe, and share.
Shooting it raw?
Yes. Shooting it raw.